Hi, today we are gonna have a review on gastrointestinal embryology and anatomy from the book First Aid for USMLE. So I will just teach you guys the topics that you should know for your reviewing. Yeah. So first, here we have first pharyngeal arc forms anterior to front of tongue, which sensation innervation for sensation is via cranial nerve 5, and taste is with cranial nerve 7. Then you have to know that third and fourth pharyngeal arcs make posterior 1/3 part of the tongue, which sensation and taste are with cranial nerve 9, and extreme posterior parts are with cranial nerve 10. Then we have motor innervation for muscles of the tongue emotions. We have a hyoglose, and which makes the tongue to go down, and genioglose, it makes a protrusion through the tongue, and a styloglose, and all of them motor innervation for all of them is with cranial nerve 12. Motor innervation with cranial nerve 10 is for politoglossus. Yeah. So we have 3 parts that we divide the gastrointestinal system into 3 parts to understand better. First is foregut, which is esophagus to duodenum until ampulla of water. 4th to 6th week of development, stomach rotates 90 degrees clockwise, which will cause the left wag to be anterior and the right wag to be posterior. Then after foregut we have midgut, which is lower duodenum to proximal full third part of the transverse colon. 6th week of development, the herniation of midgut through the umbilical ring will happen, which is physiological. And the 10th week of development, it will return back to the abdominal cavity, and then it will rotate around SMA, which is superior mesenteric artery, to 170 degrees counterclockwise. So the next we have hindgut, and it's distal 1/3 of the transverse colon to anal canal, above the pectinate line. Not all of the anal canal, above the pectinate line it will end. Then we will discuss about ventral wall defects. 2 important ventral wall defects are for the lateral part, and they are omphalocele and gastroschisis. Gastroschisis is per-umbilical herniation of abdominal contents, which is not covered by peritoneum and it's not associated with chromosomal defects, which will have a good prognosis. And then we have omphalocele, which is the herniation of abdominal context through umbilical ring covered by peritoneum and amnia. It is associated with chromosomal defects and congenital anomalies like trisomies 13 and 18 and Beckwith-Weiderman syndrome. So then we have retroperitoneal structures. We have an abbreviation of SAD-PUCAR, which is the first word of all of them combining together. First, we have suprasternal glands like adrenal gland, aorta and IVC, duodenum, pancreas, and uterus, colon, kidneys, esophagus, rectum. Sorry, I forgot almost to show you guys the pages. Yeah, sorry. So we had here gastroschisis and ampholysis. Then here we have the retroesternal structures. Yeah, we are talking about them now. Then after uterus, we have colon, descending and ascending parts, kidneys, esophagus, and rectum. And after that, we will discuss about gastrointestinal ligaments. For the first, we have falciform ligament, which is liver to anterior abdominal wall, and it contains ligamentum of Tres and paraumbilical veins. Then we have hepatoduodenal ligament, which is between liver to duodenum. Portal teriad, it contains portal teriad, which is perhaps proper hepatic artery, portal vein, and common bile duct. Then after that, we have hepatogastric ligaments, liver to lesser curvature of the stomach, and it has gastric vessels. After that, we have gastrocolic ligaments, which is between greater curvature and transverse colon, which contains gastroepiploic arteries. Then we have gastrospinal ligament, which is between greater curvature to spleen. Short gastric and left gastroepiploic vessels are in this ligament. Yeah, spinorenal ligament, which is a spleen to left pararenal space, and it contains a splenic artery and vein and tail of the pancreas. So then we have the digestive tract anatomy, which we have the abbreviation MSMS. For the first, the most inner part, we have mucosa, which is epithelium, then lamina propria, and then muscularis mucosa. And then we have submucosal layer, which has submucosal nerve plexus or Meissner, which secretes fluid, and it contains vessels. Then we have a muscularis layer, extra meandric nerve plexus is in this layer, and it provides the motility of the digestive tract. Then after that, we have serous. Rhythm frequency in different parts of this tract is duodenum is faster than all of them. Then we have ileum, and then stomach. Abdominal area and abdominal aorta and branches. The next topic I'm talking about. So GI structures are single and branch anteriorly. Arteries and non-GI structures are signal and branch laterally and posteriorly. Arteries. Two areas of colon have dual blood supply, uh, then makes this part susceptible in colon ischemia. Uh, the other parts are splenic flexure, which uh, blood supply is provided by SMA and IMA, and then we have paroxysmal junction. Um, no, sorry, we have recto-sigmoidal junction, which is provided by IMN and superior rectal artery. And after that, we have foregut, which as blood supply is with celiac artery, and the parasympathetic innervation is with vagus. And then for midgut, so blood supply is with SMA, and parasympathetic innervation is with vagus also. And then for hindgut, we have IMA for blood supply, and the parasympathetic innervation is with pelvic splanchnic nerves. The sympathetic innervation rises from abdominal tracheal ganglia, named from upper to lower, which I mean from foregut to hindgut, celiac, superior mesenteric, and inferior mesenteric. Celiac trunk, it's important to know the parts, which part it contains, that are common hepatic and splenic and left gastric. Then we have apical surface. Then we will discuss about the anatomy of the liver. Apical surface of the hepatocytes faces bile canaliculi. Basolateral surface faces sinusoid, and Kupffer cells are in these parts, and they are specialized macrophages in sinusoids. Then we have hepatic, uh, hepatic satellite cells, which are called E2. They are the source of vitamin A for the time the body needs, and produce extracellular matrix. Dual blood supply to liver are with 80% portal vein and 20% hepatic artery. Then we have femoral region. From lateral to medial, we have nerve, artery, vein, and lymphatics, which we will have the abbreviation of navel from the lateral to medial. And then we have femoral triangle, which contains femoral nerves and artery and vein. But the femoral sheath contains femoral vein, artery, and canal, which means lymphatic nodes, but we don't have femoral nerve here. Inguinal canal contains in female a round ligament, and in male was deferens. And then ilioinguinal nerve and internal spermatic vessels. Thank you guys. This was the a short summary about anatomy and embryology of this section. Please subscribe and like my videos. See you in the next video. Bye.